Open a bathroom cabinet, yours, your parents', a neighbor's, and there's a decent chance one of these is sitting on the shelf. A small ordinary pill that hundreds of millions of people swallow every single day. It's one of the most successful medicines ever made. The best-selling drug in history belongs to its family. It quietly prevents heart attacks and strokes on a scale that's hard to even picture. And it did not start in a gleaming lab or a famous university. It started as a fleck of blue-green mold, growing on a sample of rice in Japan. The man who found it there earned almost nothing from it. No fortune, no Nobel Prize, and for most of his life, no fame at all. His name was Akira Endo. This is the story of how he found a medicine in mold, and how the world took the medicine and forgot the man. Akira Endo was born in 1933 into a farming family in rural Akita in the cold north of Japan. He grew up close to the land, with his grandparents, parents, and 5 brothers and sisters under one roof. It was his grandfather who lit the spark, a man curious about medicine and nature, who taught the boy, among other things, which mushrooms in the hills were safe and which would kill you. By the age of 8, Endo had decided he would be a scientist, and somewhere along the way, he read about Alexander Fleming, the man who noticed a stray mold killing bacteria in a dish and pulled penicillin out of it. That idea lodged in him and never left, that a humble mold, overlooked by everyone, might be hiding something that could save lives. After university, Endo joined a Tokyo pharmaceutical company called Sankyo, working with fungi. And then, in 1966, he crossed the Pacific for a research post in New York. What he saw there changed the direction of his life. He was struck by how many people around him were elderly and overweight, eating richer food than he'd ever seen. And in his neighborhood in the Bronx, he kept watching the same scene repeat, an ambulance pulling up, and an older person being carried out after a heart attack. Heart disease was the leading killer in America. In his own words, living in New York made him realize what the world needed, a drug that could lower cholesterol. He went home with a mission. So let's be clear about the enemy, because it isn't quite what you think. Cholesterol is not a villain. Your body needs it. It builds your cell membranes, your hormones, your vitamin D. The trouble is having too much of one kind drifting through your blood, the kind carried by particles called LDL, the so-called bad cholesterol. And here's the part people get wrong. We picture cholesterol as grease coating the inside of a pipe. It isn't. Too much LDL slips asterisks into the wall asterisks of an artery, where your own immune system attacks it, and that slow, smoldering battle builds a deposit called a plaque. Let a plaque grow for years, then crack open, and a clot forms on the spot. That clot is a heart attack. That's a stroke. That is the thing Endo wanted to stop. Now, you might think the fix is simple, just eat less cholesterol, but the body has a catch waiting for you. Most of the cholesterol in your blood isn't from your dinner. Your own liver manufactures it, around the clock, whether you eat it or not. Cut back at the table, and the liver just makes more to compensate. So, if you really wanted to turn the level down, eating less would never be enough. You'd have to reach inside the body's own cholesterol factory and jam the machine that runs it. In the early 1970s, nobody had a way to do that safely. Endo decided he would find one, and he had a strange, almost backwards idea about where to look. Here was Endo's hunch, and it sounds like a leap until you follow it. Molds and fungi are not gentle. They live in fierce chemical warfare with the bacteria and microbes around them, and they fight by secreting poisons. Penicillin is exactly that, a mold's chemical weapon, which happens to save human lives. So Endo reasoned, many microbes need a cholesterol-like molecule to build their own cell walls. What if some clever fungus, to sabotage its rivals, had evolved a weapon that blocks the very machine that makes that molecule? If such a fungus existed, its poison wouldn't just hurt microbes. In a human being, that same molecule could be the cholesterol drug the world was waiting for. He just had to find the one fungus somewhere on Earth that made it. To find it, Endo first had to know exactly which machine he wanted jammed. Building cholesterol is like a factory assembly line. Many steps, one after another. And like any assembly line, the whole thing is paced by its slowest, most important station, the first big committed step. On the cholesterol line, that step is run by an enzyme with a clumsy name, HMG-CoA reductase. This single enzyme is the master valve. Speed it up, and the factory floods cholesterol out. Block it, and the entire line backs up and slows. So Endo's target wasn't cholesterol in the abstract. It was one specific enzyme, one machine on the line, and he needed a mold that could shut it down. So began one of the great needle-in-a-haystack searches in the history of medicine. Endo and his team at Sankyo started collecting molds. From soil, from grain, from rotting fruit and testing each one to see if anything it secreted could throttle that enzyme. Culture after culture, broth after broth. It took about 2 years and thousands of strains of microbe. Most did nothing. The first real hit turned out to be a poison called citrinin. It blocked the enzyme beautifully, but it also damaged the kidneys. Too toxic. They dropped it. It would have been easy after that to believe the whole idea was a dead end, but Endo kept screening, and then a particular blue-green mold caught his attention. The mold had been grown from a sample of rice, from a grain shop in Kyoto. Its name was Penicillium citrinum, a cousin, fittingly, of Fleming's penicillin mold. And out of it, in 1972, Endo's team pulled a brand new molecule. They called it compactin. It did precisely what Endo had dreamed a molecule might do. It clamped down on that master enzyme and choked off cholesterol production without the toxic punch of citrinin. Years later, Endo described it simply. Compactin, he said, seemed to be a wonderful gift from nature. He had been right. Somewhere out in the living world, a fungus really had invented the weapon he was looking for. Now he had to understand exactly how it worked. And the way it works is genuinely elegant. Think of that master enzyme as a lock, and its natural raw material as the key that's supposed to fit inside it. Normally, the key slots in, the enzyme does its job, and the cholesterol line keeps moving. Compactin is a forgery, a decoy key. Part of its structure is shaped to mimic that real key almost perfectly, so it slides into the lock and sits there. But it won't turn, and it grips far tighter than the real key ever does, by some measures 1,000 times tighter. So the genuine raw material can't get in, the lock is jammed by an imposter. The master enzyme stalls, and the whole cholesterol factory grinds down. One small molecule, scraped from mold, quietly switching off the body's cholesterol machine. But nature had one more trick waiting, and it nearly ended everything. When Endo's team fed compactin to rats to prove it worked in a living animal, nothing happened. The rat's cholesterol barely moved. For a drug company, that's close to a death sentence. If it fails in the standard lab animal, the project gets quietly killed, and it almost was. What Endo eventually figured out was that rats were a uniquely bad choice. Their bodies responded to the blocked enzyme by simply building more of it, racing to undo the drug. He had the right molecule and the wrong animal. The discovery of the century was very nearly thrown away over a misleading result in the wrong test subject. What saved it was stubbornness and a flock of hens. A pathologist on the team, Noritoshi Kitano, tried compactin in laying hens instead of rats, and their cholesterol dropped by about 1/3 in 2 weeks. It worked in dogs, it worked in monkeys. The molecule was real after all. And then came the moment that mattered most. In 1978, the very first human patient was given compactin, an 18-year-old woman with an inherited condition that sent her cholesterol to terrifying heights. Her levels fell. For the first time, a medicine pulled from mold was lowering cholesterol in a living human being. The dream from the Bronx, the ambulances, the wild fungal hunch, all of it was suddenly undeniably working. But to see why statins are so clever, you have to follow what happens inside the liver next, because there's a twist. You'd think jamming the cholesterol machine would just mean less cholesterol made, the end. It's better than that. Liver cells have something like a thermostat, a sensor that constantly checks how much cholesterol is inside the cell. When Endo's drug chokes off production, that sensor reads the cell as asterisks running low asterisks. It thinks the cell is starving for cholesterol. And so it does exactly what a thermostat does when a room gets cold. It triggers the cell to go and get more. That panic response, it turns out, is where the real magic happens. Here's how the cell goes and gets more. It pushes special grabbers to its surface, called LDL receptors, little hooks that reach out into the bloodstream and haul LDL particles in. The more the liver thinks it's starving, the more hooks it throws out. And those hooks are pulling the LDL, the bad cholesterol, straight out of your blood. So follow the whole chain. The drug jams one enzyme, the cell senses a shortage, it floods its surface with receptors, and those receptors vacuum cholesterol out of your bloodstream. That's the part that protects your arteries. A statin doesn't lower your cholesterol mainly by making less of it. It lowers it by tricking your liver into fishing it out of your blood. And here is a beautiful piece of timing. While Endo was hunting molds in Japan, 2 scientists in Texas, Michael Brown and Joseph Goldstein, were unraveling those very LDL receptors. They'd been studying children born with an inherited disease that gave them sky-high cholesterol and heart attacks in childhood, children whose cells were missing working receptors. Brown and Goldstein worked out what those hooks do and how the cell controls them. It would win them the Nobel Prize in 1985 for the receptor, not for any drug. Two halves of one truth found a world apart. Brown and Goldstein discovered the lock the body uses to clear cholesterol, and Endo discovered the molecule that tricks the body into using more of it. So Endo had it, a working cholesterol drug, proven in patients. And then, in 1980, his own company shut it down. Sankyo halted development of Compactin. The reason given traced back to a safety study in dogs. Dogs given enormous doses, far beyond anything a person would take, had developed tumors. Now, those doses were extreme, by some accounts roughly 200 times the human dose, and Compactin was never shown to cause cancer in people. Endo himself believed the decision was an overreaction, that the drug could have gone forward at a sensible dose, but it didn't matter what he believed. The compound he'd pulled from mold, the one that worked, was shelved, and by then, Endo had already left the company. While all this was unfolding, the American drug giant Merck had been watching closely. Back in 1976, Merck had signed an agreement with Sankyo and obtained samples of Endo's Compactin, along with his data, and used them to confirm that this astonishing idea really worked. Merck then went looking in its own molds and found a near twin of Compactin, a molecule that differed by a single tweak. They named it lovastatin. And in 1987, lovastatin became the first statin ever approved and sold to the public. Read that carefully, because the distinction is the whole injustice in miniature. Akira Endo discovered the first statin. He just wasn't the one who got to sell it. Today, statins are taken by hundreds of millions of people. Over 1 billion would qualify. The single best-selling medicine in human history is one of them. The money involved runs to many billions. And Akira Endo, the man who found the first one in a fleck of mold, never received a cent in royalties. He'd made his discovery as a salaried company scientist, so the rewards flowed to the company and later to others. He was never made wealthy by the drug class he founded, and the prize that crowns a life in science, the Nobel, never came to him either. He was named year after year as one of the great deserving omissions. The call simply never did, but the people who understood the science knew exactly what he'd done. Michael Brown and Joseph Goldstein, the Nobel laureates themselves, said it plainly. The millions of people, they wrote, whose lives will be extended through statin therapy, owe it all to Akira Endo and his search through fungal extracts at the Sankyo Company. The honors that could come did. Japan's highest science award, the Japan Prize, in 2006, the Lasker Award, often called America's Nobel, in 2008 for the discovery of the statins, the Gardner International Award in 2017. Brown and Goldstein had a name for what Endo gave the world. They called it a penicillin for cholesterol, the mold medicine dream come fully true. Akira Endo died in 2024, at the age of 90. A colleague remembered him as a man who could see the hidden essence of things, which is exactly what he did. When he looked at a speck of mold on a grain of rice and saw a medicine for the human heart, he chased a strange idea through thousands of failures to a fungus most people would have washed down the drain. And the thing he found is now sitting, quietly, in hundreds of millions of medicine cabinets, extending lives every single day in people who will never once think to ask where it came from. So the next time you see that small, ordinary pill on a shelf, remember the fleck of blue-green mold and the farm boy from Akita who believed, against all of it, that nature had already invented the cure. He just had to go and find it.